We're going to move into a standing series. Before we begin the standing series, I'd like to open up the posturally tight hamstrings, lying supine with your heaviest Theraband to put around your dominant foot first. If your hamstrings are super tight, which they will be with sway back, you're going to want to put the anti-burst ball under your head so that your neck isn't straining as you stretch these tight muscles. We'll be here for a full minute, opening up this area that's tight. Watch out for the pelvis here. I want you to think about tipping your pelvis towards whatever is in front of you, towards your foot that's extended out in front of you, creating a mouse hole between the low back and the floor. We don't want to exacerbate that pelvic flexion that's causing chronic low back pain. So you need to find some low back extension. You can take one hand and slide it under the low back to check if there's that mouse hole there. That's going to be imperative that you keep some space there. Try to not crunch those fingers. Tip that tailbone, arching the low back without pushing the belly out. So keep the abs pulling in and up. On your next exhale, slowly switch legs. Take your time. It's a tight area. We don't want to pull anything in the process of switching. Check in with the pelvic position again. Tip it down, finding that extension. Find an imprint of your mid-back and upper back. And imagine those front ribs reaching for the back ribs, imprinting them as well into the floor. Plug the shoulders down the back. Increase the distance between the chin and the chest. You can even squeeze the front of your thigh to lift the kneecap a little more to intensify the stretch. Watch out that it doesn't cause you to go to flexion in your pelvis, so keep some extension. You can always hold one hand under the low back at all times, just as a marker if you find that you're always flattening the low back into the floor. On our next exhale, we'll slowly make our way up to standing. For this exercise, we need to tie, and it's important that you tie the end of your band in a knot to your roller a quarter of the way in. We're going to be doing an overhead press with our outside arm, isometrically holding that the whole time. We're going to bring our metatarsals onto the roller, standing by a wall, and we're going to do some calf pedaling on our exhale. Our inhale will ground for balance purposes, and our exhale will pedal, kind of like you do when you're doing down dog pedaling, but we're going to have the challenge of stability, which will help us recruit the lower underactive pelvic floor. So stepping up onto the roller, feet can be hip distance or together, depending on your balance. Hip distance is going to be a little easier. Together is going to be quite the challenge. Arm overhead, isometric hold, and then from here, your heels are going to come off of the roller a little. So come onto the pads of the feet, pull your abs in, bend your knees. Inhale, prepare by pulling the pelvis towards the roller. Exhale, pedaling the feet, dropping one heel and then the other. And this is about the calf flexibility, this posturally tight area. And it's also about using the core to initiate movement. So I want you to pause on your inhale, pulling your pelvis down towards the roller. On your exhale, we pedal. The heels are moving. We're switching, bending the knees, but we're driving. The driving force is that lower pelvic floor pulling in and up to stabilize you here. Inhale, prepare. Exhale, pedal. 2, 3, 4. Inhale, prepare. And exhale, pedal. 2, 3, 4. One more time. Inhale, prepare. And exhale, pedal. 2, 3, and 4. Good. Okay, so from here, let's stay on this side for our frontal plane balance exercise before we go to the second side. So stay on the roller. I want you to bring your outside arm into cactus, so it looks like this, and you're just going to keep it in cactus. Step your feet a little closer to the wall. What we're going to do is we're going to step onto our outside foot, bringing our inside leg into side knee flexion. So side knee flexion, and then from here we're going to inhale, prepare, exhale, bending the torso towards that knee, coming into a little bit of an oblique crunch. Give me 3, 2, 1. Pause, inhale, ground your pelvis again, exhale, bend again. 3, towards that lifted leg. 2, you can point the toes of the lifted foot. 1, again, inhale, prepare, and exhale, bending towards it for 4, and 3. Breathing 2 and 1. Step towards the wall again, same side. We'll repeat. I want you to step to the side to that unilateral balance. So stepping onto our outside foot, outside arms in cactus, bringing the inside leg into side knee flexion, pointing the toes. Keep the hips even. And inhale, prepare. Exhale, oblique crunch for 4 and 3. Core is tight. 2. Closing the front ribs. 1. Inhale, prepare. Again, exhale, bend. 2, 3, 4. 1 more. Inhale, prepare, and exhale, bend. 2, 3, and 4. We'll slowly make our way to the other side. We're going to begin with the calf pedaling. So turn yourself around. Remember, soft bend in the knees as you step up. Outside arm comes to shoulder flexion in the isometric hold. Inhale to ground your pelvis. Initiate from the pelvic floor lift as you pedal your heels, stretching out actively that gastric medius that's posturally tight, driving from the weak pelvic floor muscles to strengthen the lower abs for better posture and alignment. Keep that going. Inhale, prepare. Exhale, pedal. 2, 3, 4. Inhale, prepare. And exhale, pedal. 2, 3, 4. 1 more. Inhale, prepare. And exhale, pedal. 2, 3, 4. Bringing the outside arm into cactus, stepping closer to the wall. We're going to be moving on to our non-dominant, actually this probably is your dominant leg if you're right-handed. So we're going to step onto that outside leg. Inside leg comes to side knee flexion. Pause for a moment. Ground your pelvis. Inhale. Side bending. Exhale. 4, 3. Lateral flexion. 2. Good for those external obliques. 1. Inhale. Hold. Ground yourself. Exhale. Bend. 2, 3, 4. 1 more. Inhale. Prepare. And exhale. Bend. 2, 3, 4. Step towards the wall again. Same thing. We're repeating, stepping to that single leg balance. Find the balance first. Point the toes of the lifted leg. Inhale. Pelvis pulls towards the roller. Exhale. Inner thighs pull back as you bend to the side. And your pelvic floor muscles support this movement. Inhale. Pelvis pulls down. Pelvic floor muscles pull in and up. Bend. 4, 3, 2, 1. 1 more. Inhale. Pelvis pulls down. Exhale. Bend. 2, 3, and 4. Slowly stepping off of this roller. I want you to face the wall for a postural stretch for your shoulders. Bring your dominant arm up into a high V. You'll be on the inside of the thumb and the wrist, and we're going to twist away from that arm, opening up your anterior delt here. Bend the knees a little bit, and inhale 1. Breathe. Exhale, grounding the body, lengthening the torso, using your abs to deepen the stretch, twisting on the exhale. While we're here, you can do some diaphragmatic breathing, breathing into the belly, soft bend in the knees, relaxing the nervous system. Just inhale, expand the abdomen, and exhale, let it fall back in towards the spine. Inhale, expanding. And exhale, letting it come back in. And one more time, inhale, expand. And exhale, it comes back in. Go ahead and face the wall, switching sides, bringing it into that V, twisting away. Let's bring our outside hand to the belly. Try to fill it up like you're mimicking a pregnant woman. Give me that big belly. Inhale, 2, 3, 4, 5. Exhale, let it fall in. 2, 3, 4, 5. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. One more. Inhale, 2, 3, 4, 5. And exhale, 2, 3, 4, 5. Good job.